first podcast for the Make It Thrive project. It is an application for the Erasmus Program Key Action 2, Cooperation Partnerships in School Education, submitted by the Gondomar City Council in Portugal, with a partnership of TTM 2000, an Italian company, the Directorate of Primary Education of Irakliou in Greece, and Virtual Campus also from Portugal. The Make It Thrive project aims to develop an online platform to assist teachers of the second and third education cycle, teachers of students with mental health issues. So in our first podcast, our guest is Argyro Kosmadaki, a primary education psychologist with the bachelor's degree in psychology from the School of Philosophy, a master's in child development for the University of Stirling. She has 4 years of training in drama therapy. So far, so good?
Yeah.
She has a master's degree in progress in applied developmental psychology and works as an educational psychologist for about 1.5 years now, before which she worked in special education centers with children ages from 4 to 16 years old. Welcome and thank you for being available.
Thank you too.
Our first question, Argyro, has to do with your experience after the COVID-19 pandemic. So many indicators will show that the intervention in this context is necessary in schools, especially after the pandemic, and especially so in southern countries like Portugal, Italy, and Greece. The scenario regarding mental health in schools was already an issue before COVID-19, but the schools have seen a key context in the early identification of mental health problems in students, with teachers being an important agent in identifying signs and referring them to mental health professionals such as yourself. So in your opinion, how has the pandemic affected positively or negatively mental health in schools?
Okay, let's start with the fact that no one was unaffected by the pandemic. We all had to change our daily routines and activities. We stayed more than we used to before, and we stayed all together. So many things changed for children too. Also boredom, fear, fear of the unknown, loneliness, stress were common to everyone. For children, staying at home meant less time socializing and more time online with gaming or social media. And this had an impact on their social skills, which is becoming more and more obvious still. Also, they had to experience fights and divorces because many things happened when we all stayed together, like abuses too. So now we can see a huge deterioration in children's social skills, especially in children that had to start school in 2020 because they didn't get the chance to get to know their teachers and classmates better. They didn't know how to adjust in a new environment with regulations and schedule and all this.
Where do you see the most issues from the kids that had to adjust from home?
Of course, there is a huge effect on the children that were starting school then, between 2021. But it all depended on how parents treated all this situation at home. The more they stayed inside, the more fear they had, the more difficult it was for the child to adjust afterwards. Back then, I had many cases of children who had family members with serious health problems. So when they were going at school, they were always careful and afraid of getting sick and don't get any close to anyone. They didn't attend at least for 2 years social activities with other peers. So in small ages like that, they have to make an effort to overcome these difficulties that came up.
Now, a different question has to do with mental health being the foundation of general well-being. It's like saying there's no healthy body without a healthy mind. How do you see that presented in schools?
Of course, anxiety and depression are very common, and it's weird because a few years back we didn't say depression for children, but now we can see that there are signs of that, and there are some diagnoses with depression. Also, of course, ADD, attention deficit disorder, oppositional defiant disorder, autism spectrum disorders, panic attacks, and many psychosomatic problems also. And in older ages, we can also see suicidal behaviors or thoughts.
Okay, and what signs can you detect?
I think the easiest one to detect is school denial, which may be resolved from many reasons. School denial, along with the psychosomatic symptoms for which children tend to complain a lot, are something that it's easier to detect. But also, when suddenly a child starts to have a poorer academic performance, it's something that should worry us.
It's deteriorating.
Out of the blue, or a lack of concentration, withdrawal, or continuous sadness, especially in children that were used to be very active socially. Every change.
Sudden change.
Yeah.
Okay.
Also, aggressive behavior towards others. That's something we can see. It's very common. And what also worries us is the lack of boundaries, tolerance, and empathy, and the inappropriate expression of feelings, like anger.
You did mention something similar, but is there a risky kind of behavior that we can link to mental health disorders?
So, students doing something risky that can affect their mental health.
For example, is this what you would describe as defiant behavior, risky behavior?
Yes, but mental health isn't something that comes from one day to another. Usually it's a multifaceted phenomenon. So there are genetic and environmental factors that contribute to mental health. The first risky behavior that comes in my mind, apart from drug addiction, is internet addiction, which can cause many problems to children, like aggressive behavior, educational or financial problems, lacking social interactions, with social withdrawal, and of course bullying, which affects both the victim and
the perpetrator.
Yeah.
And is age one of these factors? Does it matter in this context? I mean, the older you get, the older the students become, is it different how their behavior changes? Is it different to see a child, let's say 11 years old, regarding their mental health issues compared to a child that's 7 or 8?
There are differences because also their cognitive development is not the same in every age. So there's always a difference. But we can find signs from early ages. So the sooner we intervene, the better. I mean, maybe there are some small things that maybe parents don't pay attention to, but all these sudden changes should worry us, and we should intervene as soon as possible.
Okay, so in this context, what can the school do to intervene as soon as possible, as you say?
Okay, let's start with the fact that for some children, school is actually their only chance for someone to detect their problems. If they are abused at home or live in an unhealthy environment, or if they are neglected by their family, school is the only place where they can find support, acceptance, help. But on the other hand, a child is not growing up in only one context, he's not growing up only in family, in school. So school should promote a coordination also with families and society, and a child should feel safe at school. So school should promote an environment of trust and acceptance, and put stress on children's social skills and social interactions. If there is a psychologist at school, of course they can intervene, or class-wide or individually with children. But I think school has a bigger part to play, bigger than we think. School could create like groups for parents, so parents can share their experience, their fears, their concerns. Also, many parents don't know anything about mental health. Maybe they see something happens to their child, but they don't know that this is something that should worry them. So school can coordinate with community informative lectures. So parents will learn what is mental health, what problems we see at schools, what are the signs to detect them, what can we do about them.
In this case, the school acts as an intermediary between the family
I think they should.
They should. Okay, let's talk numbers. The World Health Organization says that about 20% of children and adolescents around the world suffer from a behavioral, developmental, or emotional problems. If we put that in a classroom with 30 students, that means 5 or 6 do face some sort of particular mental disorder. What is the picture that we paint in Greece?
I would say that they're quite similar, but there's always an unknown percentage of children who are at risk for developing mental disorders. So we should also think that there's more than that. Children who have parents with mental health illness, they are at risk of developing themselves again problems of in mental health. So the percentage actually is more. And we also try to avoid for them to develop, like prevention, to prevent.
We prevent the impact of the family environment to the child. So actually, you expect more than 20%.
No, not more, because maybe it's not right now, but maybe it is in the future.
It could become.
And also imagine that here in Greece, and especially in smaller cities like Heraklion, mental health is still a taboo. So we have many cases of children who should have gotten diagnosis, but they haven't, and they might not ever get one.
Okay, there are programs and plans in place to work with and support schools. Now, such plans exist because there is an increasing number of children and adolescents who experience difficulties in responding to the developmental challenges they face and who suffer the negative effects of mental disorders. The prevalence of mental disorders among children and adolescents has increased in the last 20 to 30 years. How is the Greek reality facing the practical aspect of that rise?
Okay, Greece has made some steps towards mental health, but there is more to be done. For example, right now there are programs running with psychologists at schools for intervention assessment and consulting, but on the other hand, psychologists, first of all, they don't start school, most of them don't start school from September, like all the rest.
They come in later.
They come in later, but that means that they are missing a very critical period, the period of adjustment for many people. So when they actually go to school, they already see some established cases. Also, not every school has a psychologist, and those who do, it's usually for once a week, which means that every psychologist has 5 schools. This means more work for the psychologists, but also for teachers, more responsibilities, because when something comes up, they have to deal with it right away. They cannot wait for the day of the week to come.
But it also creates a problem for the child because they don't know who the professional is.
Of course.
And they cannot establish a trust.
Yeah, especially in younger ages, where they don't even know what a psychologist is. They don't know from where they could help, who can help them. They are not used to the idea of the psychologist at school, and it's funny because even the children understand how unhelpful the one's week is. So one child once, a few months ago, he told me, okay, when you are here, the day you are here, we're going to solve our differences through talking and using our skills. But all the other days, Monday, Wednesday, Thursday, and Friday, we're going to fight. But you're not here, you're not going to see what happens. So yes, that's why I said from the beginning that more should be done here. Apart from psychologists, there are also medical educational centers, public medical and medical educational centers, and centers for interdisciplinary assessment, support, and consulting, along with outpatient clinics in general and psychiatric hospitals. But there, the waiting list is long. So many parents have to turn to private practice professionals,
which they pay out of their own pocket.
Yeah, but okay, public health insurance covers a portion of that cost. Sometimes though, this refund comes a bit late, so many families are not okay with it. So if you don't have a chance to choose the private path, you have to wait. So this fact means that many children don't get the help they need on time, and many parents are discouraged, so they even stop seeking for help.
It's a vicious cycle.
Yeah.
It's a dark cycle.
Yeah.
Okay, let's see. In school communities, the effectiveness of an approach that includes the entire school is highlighted. Now that model is used to promote skills, social skills, and use peer education. How useful is it for new programs to be integrated in that sort of context of the entire school, allow cross-fertilization, creation of new structures?
Children are not growing up alone, they are growing up in multiple contexts, and our purpose should be to make children resilient, and the only way to succeed that is with collaboration between family and community and school. For example, as I said before, we have many children whose parents have mental health issues, and sometimes even the school doesn't know about that fact. So many children who, those children need help, and we cannot provide that help to them because no one has informed us about that. So some issues that could have been avoided, they don't. The interested parties should participate in mental health and mental health prevention and information.
One last question, and that has to do with the toolbox that we expect to create in this this project, the Make It Thrive project. We hope and we intend to create an online platform, a set of tools for teachers mainly, of students aged 10 to 15, so older ages of primary school and middle school teachers, students, who face mental health issues. Is that something that would be an added bonus? Or is it going to be something useful, you think?
Yeah, I think it would be very helpful. Sometimes I feel that teachers feel like they are left without any help, and that too many expectations are on their shoulders. Before starting working at school, I didn't even know how much work they have to do. Not only to prepare the classes, but all these things that they have to deal with with them every day. So it should be important for them to have something like a compass or a guide to help them with all these diverse problems, situations they have to deal with the children on the daily basis.
Let's hope for the best then. Thank you so much.
Thank you
for being
too.
with us today.